sigma female. Okay.
So, how can you improve KPIs by implementing Six Sigma in hospitals?
Okay, that is a very important question. So, right, like I said in my previous lectures, KPIs are key performance indicators. Okay, when you start using KPI, you collect data from different parts of the hospital. So, every hospital ideally should be a data-driven hospital. Hospital should conduct all its activities based on data. Okay, so when you collect data, these data give you the key performance indicators. Okay, so whenever you want to implement Six Sigma in any area of the hospital, we use a process called define, measure, analyze, improve and control. Okay, the last part of this is called the control chart. Control chart. Okay, and when you have a control chart, you know that this is the standard you want to achieve. Okay, but whatever activities are, when you collect the data, those data may not be in line with these activities. That means, let us take an example of a patient waiting for more than half an hour outside the doctor's OP. Let us say that we have a time frame that a patient should be seen by a doctor between 10 minutes to 20 minutes. Okay, right? So the lower limit is 10 minutes, upper limit is 20 minutes. Okay, right? So, but when we check the data, when we get the KPI from the clinical areas, we find that the patients are waiting for more than 20 minutes in the hospital. Many patients have been seen in this during these times, but many patients are waiting for more than 20 minutes in the clinic, outside the doctor's clinic. So, if you find these patients waiting for more than 20 minutes, then you should go for a root cause analysis. Okay, that is the define problem part of Six Sigma. That you have to define the problem. The problem is waiting time is more than 20 minutes. Okay, so then you measure. This is 20 minutes, this is 30 minutes, this is 15 minutes, this is 40 minutes, like that. So you have a lot of measurements. Okay, you measure the problem. Then third is you analyze the problem. How do you analyze? You can do a root cause analysis, you can do a 5 why analysis, like asking questions to all the people, patient, doctor, nurses, why this is happening. So you will get lot of answers from this. You can do a fishbone analysis, right? You get lot of answers. So when you get these answers, you have analyzed the problem and then you go for improve stage. So when you analyze, then you can go for the next session where you will do a brainstorming or a brain writing or various tools can be used, and it will give you how to improve the problem or how to solve the problem. Once you get the solution, then you implement it here. Then you implement those solutions in here. For example, a doctor is saying that there are too many patients in front of my OP. So there is a lot of delay in seeing all the patients. So maybe the doctor needs an assistant, okay, or a secretary, or somebody to type the report. Or the doctor may be saying that my system is slow. So you have to correct the system, right? So there may be a lot of problems in that. So you have to solve all the problems one by one, so that ultimately all the patients will be within this line. Okay. So this chart is called the last part, control chart. So the last stage is the control chart. So once you bring all the patients within the upper and lower limit of your control chart, this is the Six Sigma level. So when all the patients are within the control chart, then you try to maintain everybody within this chart. Okay, and if you consistently maintain, this problem will be solved. So the problem is given by the KPI, but it is solved by the process called DMIAC, which is Six Sigma method. Okay, so KPI will give you all the data. Based on the data, we will prepare a graph. From the graph we will know what are the data that are outside our limits, and if somebody is outside the limit we will try to find the root cause. Then we will define the problem, we will measure it, we analyze, we improve. After analyzing we will implement it and improve, and finally we will keep it under check, control. Once it is in control, that problem is solved. Okay. So this is how you connect KPI with Six Sigma. Is it okay?